I just wanted to share with you the Vanderbilt journey through the challenges that all of us have faced with sterile compounding over the last several years and what strategies we have employed to help us with these challenges. The objectives for today's discussion are to provide an overview of the components of the Sterile Products Compliance Program at Vanderbilt University Medical Center. We're going to review what preparation activities we have employed for getting ready for regulatory surveys. I'll review our internal compliance survey process and the improvements we have been able to make based on our findings, and then also review the various roles of key members in the department and the committee structures we utilize. And finally, just summarize the current projects we are working on and then future goals for the program. So I'm sure many of you know that the folks at Critical Point have been compiling data from sterile compounders nationally for the past several years regarding compliance with USP compounding standards and have published several iterations of this information in Pharmacy Purchasing and Products newsletter. As you can see from this publication, which was the 2016 USP 797 compliance study, improvements continue to be made in these various areas across the board. Some of this may be due to the fact that at least 35 state boards of pharmacy have specific language in their rules now that require some level of compliance with USP 797. However, due to the logistics and costs associated with complying with USP, regulatory updates that are constantly coming out, such as USP 800, that compliance will be mandated by July of 2018, USP 797 revisions that we anticipate coming out sometime in the next year or two, and FDA guidance, we still have a lot of work to do. As I mentioned previously, we should look at this as a journey and not a destination. And in addition, it's important to keep in mind that while your institution may be 100% compliant with addressing all of the domains listed on this slide, you may have found with monitoring, as we have, that process improvements are continually necessary. So this is kind of a snapshot of the Vanderbilt sterile products journey. Between 2004 and 2012, we used USP 797 as a best practice resource. We tried to be compliant with as many components of the guidance as we could. We developed a standardized training program. We have several compounding areas, which I'll discuss in a few minutes. And it's difficult sometimes to standardize processes across the board. So we really worked hard to standardize training. In 2012, the NECC meningitis outbreak occurred. We hired a sterile products consultant firm to come in and help us with our processes to try to determine what we could do better and what process improvements we could make. In 2013, the Tennessee Board of Pharmacy adopted USP 797, and we all started to prepare for the Board of Pharmacy to inspect us based on our sterile compounding activities. We developed a sterile products oversight committee and several subcommittees to help us with to process the information the consultant had provided for us, as well as to prepare for process improvements. We also conducted 11 clean room renovations in a very coordinated manner to try to get all clean room areas up to standards. And then in 2017, we started conducting, really in 2016, I'm so sorry, I'm out of order. In 2013, we also developed our gap analysis from the Board of Pharmacy, did some SOP development, standardized several processes, and started looking at compliance in our own areas. So this was area supervisors and managers that were doing compliance reviews. In 2016, we had our first Board of Pharmacy inspection focused on sterile products. We identified some centralized support needs, and that kind of is how our sterile products compliance program was created. And we identified those centralized support needs. So our sterile products compliance program is fairly new. It's been in existence for about a year now. In 2017, we started doing some internal compliance surveys. So instead of the area supervisors and managers conducting local compliance reviews, we started to do that kind of in more of a corporate manner, trying to ensure consistency across the board. We've been working on updating our training program to provide even more consistency and content. We are trying to insource as many services and certification and monitoring processes as we possibly can. We're working quite a bit on supply management and USP 800 preparation with our colleagues in nursing, safety, and occupational health. And we're still working on ongoing compliance and process improvements. I really don't anticipate that changing. I think we're going to continue to be working on compliance and process improvements till the end of time, because we can always get better. So with the creation of the Sterile Products Compliance Program, 2 FTEs were allocated, one for a program director and one for a support technician. I anticipate this continuing to grow as standards change. We anticipate increased monitoring of our environments and increased media challenge frequency with USP 797 updates. So I anticipate needing to add FTEs to this program in the next 2 to 3 years to help support those activities. The Sterile Products Compliance Team has a variety of responsibilities here at Vanderbilt, which include ensuring compliance with various regulatory standards, including USP, the State Board of Pharmacy rules, federal standards such as the FDA guidance, OSHA and NIOSH, Joint Commission, and then any best practice organizations, ASHP, ISMP, as well as Critical Point, Vasante, and Pharmacy OneSource, a lot of those companies that do webinars out there. So we're responsible for kind of monitoring the information that's out there and applying that to our practices here at Vanderbilt. We also monitor all sterile compounding areas for compliance through our internal survey process, which I'll describe in greater detail in a few minutes. We also help to evaluate processes and provide suggestions for process improvements or troubleshooting for areas that have a hard time meeting compliance standards or balancing workflow challenges with compliance needs. Our focus over the last year or so has really been on standardizing as many processes as possible across all of our compounding areas. And this has really helped us to identify issues to maximize resources. That has been very key. We've determined how we can save money and maximize our resources by providing some standardization and also to improve quality and compliance. We have about 17 policies and SOPs addressing various sterile compounding components, and the Sterile Products Compliance Team is responsible for the annual review and updates of those documents, which often include process improvements and changes, and alternately, sometimes our efforts with process changes will drive more frequent document updates. We provide sterile compounding education and support for the department in a variety of formats, including weekly newsletters, flyers on new processes, email communications when necessary. We've attended staff meetings and stand-up meetings, especially when we're trying to focus on specific compliance issues. And then we also conduct one-on-one coaching during compliance surveys that I'll also discuss a little bit in further detail. We've participated in some focused group education activities when requested from various areas, and we're also in the process of revamping our training program, as I mentioned. Budget management is important for all of us in healthcare, and we've worked with our pharmacy procurement team to track and control the budget for process improvement initiatives, the various supplies we use in the clean rooms for cleaning and garbing, personal protective equipment, etc. We also work with our Space and Facilities Department to help coordinate any renovations that we might need, improvements to rooms, mechanical issues with our HVAC systems, our clean room environments in general, and even plumbing on occasion. I had no idea when I took this role that I would become proficient in space and facilities design and communication with our plant operations team. The Sterile Products Compliance Team is also responsible for coordinating environmental monitoring activities. We assist areas with proper temperature and humidity monitoring. We recently completed a large project to replace all of our MagnaHelix gauges in our clean room areas for monitoring room pressures. And we've taken over the responsibility to coordinate the semi-annual room certifications for viable and non-viable testing. And then we're currently working on a project to move viable sampling to in-house on a monthly basis. We also monitor outsourcing relationships and inspections related to those. We try to keep outsourcing to a minimum, but they are necessary in some cases. And then we help manage vendor relationships, including prospective services that may be considered for future use and how those relate to our current compliance standards and our SOPs. So as far as our departmental design with sterile products, we have 8 pharmacy licenses, and in those 8 licenses we have 11 sterile compounding areas. We also help with operations with personnel impacts, with process improvements, or issues with occupational health exposures. We work with human resources regarding requirements for staff to meet competencies and maintain compliance. We work with medication safety and participate in those committee activities and interact with this team both for support for sterile products and also input on other medication safety issues throughout the institution. We work with our pharmacy informatics team to help us with various software programs used in sterile compounding, medication label management, etc. We work very closely with our compliance and process improvement team to monitor compliance across all areas, not just in terms of pharmacy sterile compounding, but also sterile activities throughout the hospital, such as in the OR and anesthesia areas. We help ensure Joint Commission compliance in these areas, and we also work with our process improvement and compliance team on hazardous medication handling issues. Our procurement and inventory control team, we work very closely with them to manage our supplies, work on medication back orders and shortages, evaluate new program expenditures, and help manage the budget. And then our pharmacy administration we work closely with to solicit support for different expenditures, for new processes, and to provide feedback to them about the activities that we're doing to help improve our quality. We also work with a variety of other departments within the institution, the allergy clinics obviously for allergen compounding, our nursing and anesthesia colleagues for aseptic technique and proper processes and adherence to policies and SOPs. We work closely with environmental health and safety for medication waste, and also have worked very closely with them on USP 800 planning. Occupational health and human resources, as I mentioned, for staff exposures, issues with access to the clean rooms, etc. Accreditations and standards has been very key with our survey preparation, which I'll mention here in a few minutes. Risk management, space and facilities planning, and plant operations, all key partners in what we do every day in sterile products compliance. We work with environmental services to help with our cleaning, not our cleaning of our clean rooms, but also access to the pharmacy areas, infection prevention. When we're speaking about, evaluating what our various soaps that we may use in the clean rooms and what may be approved for use in the hospital. We work with our lab for species identification whenever possible, and then our biomedical engineering department for equipment, calibration, etc. We are responsible for, obviously, USP 797 compliance. We help coordinate the gap analysis review every year and any changes. We manage policies and procedures, and we're trying to be strategic about proposed 797 updates and planning. We've worked closely with nursing, environmental health and safety, occupational health on USP 800 planning. We're kind of mired in the middle of that now, as I'm sure all of you are, performing assessments of risk, planning on renovations where necessary, developing policies and procedures or updating those as necessary, and we're coordinating with quite a few departments outside of the pharmacy to get that work done. As I mentioned, one of our main areas of focus over the last year has been standardization of processes and maintaining consistency across all compounding areas. One of the ways we've done this is to focus on survey preparation activities. We started by determining a standard method of keeping necessary documentation for surveyor review. So we coordinated this through education and communication. We provided a standardized list to each area for required documents that they needed to have ready for surveyor review. And then we conducted mock surveys in each area to review the documentation and provide feedback for improvement. We also conducted process and technique reviews during these mock surveys, going into the IV room to watch hand hygiene, cleaning, and compounding activities, and gave one-on-one feedback and coaching to those staff members and their supervisors as we observed any issues or improvements in technique that we could provide. Staff were also verbally quizzed on their knowledge of USP standards, SOP content, clean room design, cleaning activities, hand hygiene and garbing, and aseptic technique. We provided one-on-one feedback, as I mentioned, to staff involved in the surveys, and then we used our compiled findings to provide education to the entire department in knowledge deficit areas that we identified. Then during the actual survey with the Board of Pharmacy, we attempted to coordinate our response teams in a way very similar to the way we handle other surveys, such as Joint Commission. We employed an electronic notification process when the survey began and ended, which allowed key personnel to respond and travel to the survey areas if they were necessary to be present during those surveys. We attempted to coordinate our response by providing an agenda, employing key personnel to gather documentation, conduct area tours, and answer any questions from the surveyor. The Office of Accreditations and Standards was also on hand to assist us with this coordinated response to any requests from the surveyor, and they also helped us gather and organize documentation, which was a huge help because it really let us, hold a conversation with the surveyor, answer any questions they might have, while the Office of Accreditations and Standards was really focused on gathering the requested information for the surveyor. With this effort, we were very pleased that we were able to provide a consistent response during each survey, keeping the process efficient and organized for both the department and the surveyor. And consequently, we had no major findings in any of the sterile compounding areas for the 2016-2017 review cycle, which made us very happy. As many of you know, the FDA has been very active over the last year, publishing compounding guidance documents for both 503A and 503B facilities. We continue to monitor our processes for compliance with this guidance, and I'm sure everyone here today is, we're eager for the hospital and health system compounding guidance document to be published in its final form. The 1 mile rule in particular is of interest to us as we have a widespread presence throughout the mid-state and even further. So we're all waiting with bated breath for that document. We are currently in our Joint Commission window for inspection and anticipate that our next survey will definitely have some focus on sterile compounding activities, so we continue to work with our compliance and process improvement team and our accreditation and standards colleagues to prepare for that. And we are, as I'm sure many of you are, actively working closely with our nursing, procurement, environmental health and safety, and occupational health teams on USP 800 planning, employing best practice guidelines such as OSHA and NIOSH, as well as USP 800 to help us with this effort. As I mentioned before, we are conducting internal compliance surveys, or what we sometimes call SWATs, for sterile products compliance. The process is very similar to what I mentioned, what we did to prepare for our Board of Pharmacy surveys. We just took that process and formalized it into a regular frequency of inspections that we conduct in all of our 11 sterile compounding areas. We assess compliance and technique and staff knowledge of aseptic technique, hand hygiene and garbing, policy and SOP content, and also the physical documentation that each area is required to keep on hand at all times in case of an inspection. We provide education and interventions whenever necessary. We provide resources. We're starting to see that staff see us as a resource and are willing to ask us questions and say, hey, I read this in the SOP and I had some questions, I don't really understand that, or I interpret it this way but my colleague interprets it another way. Can you help us, kind of clarify what that requirement is? And it's really worked out great because I think that the staff sees us as a reliable resource. They know they can call us or email us or talk to us when we're there doing a survey. And it helps reinforce education from area supervisors and trainers that they have given, and so we're just kind of saying the same thing again, and I think it really has made a big difference in our staff knowledge and compliance. These surveys are unannounced. We don't tell areas when we're coming. We don't even tell area supervisors when we're coming. We have 1 to 2 surveyors depending on the size of the area and the amount of documentation and clean rooms in that area. We're currently in the fall and winter, when we were preparing for the Board of Pharmacy visits, we were doing these surveys monthly. Currently we're doing each area quarterly. So we visit each area quarterly, and sometimes we actually visit them more often if we identify issues or get a request from the area to visit more often. We provide reporting as real-time feedback to staff. We also compile an area-specific report after each survey and send that to the supervisors, technician and pharmacist leaders, and anyone else who really wants to see that report. We provide them feedback so they can choose how to communicate process improvements to their staff. They can either do that through stand-up meetings, staff meetings, emails, or handle it specifically with individual staff members. And then we also provide an aggregate report quarterly to our sterile product subcommittee and oversight committees so they can see how we're doing with processes. So this is kind of an example of our compiled data. You can see how many interventions we had to conduct in the 4th quarter of 2016 versus the 1st quarter of 2017. And hopefully this illustrates what our education and intervention processes are doing for our institution. So as you can see, in the 4th quarter of 2016, we had 18 instances where we had to either provide feedback or do some kind of intervention for an area in their processes for hand hygiene and garbing. And in the 1st quarter of 2017, we only had to do 8. And so that's huge, because we really feel like we are making a difference in our education activities, and it's validation and justification for all the hard work that we put in over the last year or so. So hand hygiene and garbing, just to give you an idea of what we were looking at, if we had a finding or an intervention, that could be anything from touching sterile surfaces of gloves while they're donning their gloves, the chemo gowns that they wear not being closed completely in the back, incomplete coverage of hair or skin, or even if we just made a suggested improvement for better technique when performing hand hygiene and garbing. And a lot of that information that we've used in the last 6 months or so has actually come from the education that the Board of Pharmacy surveyor has given to us as well. So we've tried to use the information that the Board of Pharmacy has provided, because they're really trying to make a huge effort in education as well, and incorporate that into some of our training of our staff. As far as knowledge of clean room design, we question staff about, do they know what the requirements for temperature and humidity and room pressure are for a room? Do they know what the ISO classification of a room should be and what air changes per hour are required for an ISO classification? And then what the lines of demarcation mean and how they're properly used. So if we had any, I think that's probably been our biggest area of improvement. I think most of our staff didn't have a solid knowledge of clean room design requirements. Our leaders did, certainly, but not our frontline staff. And so I think we've been able to make a huge impact on what they understand about how the rooms that they're performing aseptic activities work and why it's important to maintain them. As far as cleaning, we asked questions about, the frequency, the order, proper use of supplies, and then we watched them clean and made suggested improvements, and we're still working on that. And then for aseptic technique, we may have given feedback about too rapid movements or manipulations within the PEC. We've got some well-trained and experienced technicians, and sometimes they just kind of fly through those compounding activities, so giving them feedback to slow it down, not disrupt air within the PEC, make sure they're properly sterilizing supplies prior to introduction into the PEC, or even blocking first air in some cases. And as you can see, this is just another representation of the information. Most of what we have found in areas of intervention focus have been in hand hygiene and garbing. It's what we do, we do that every day, multiple times a day. It's very easy to have poor technique sometimes when you do something over and over and you're putting on gloves. If you don't do it the right way and you get into bad habits, you can miss, you can touch your thumb on the non-sterile part of the glove. We have found that quite a bit. And so we're really trying to focus on hand hygiene and garbing, because that's where we find the most issues in our institution. And And then also knowledge of clean room design. We don't find it as often anymore, which is great, but aseptic technique and knowledge of cleaning process requirements are other areas that we have focused on. We provide some education with nursing and anesthesia. We've actually done some educational documents with our anesthesia colleagues to help OR staff understand the importance of sterile products, compliance with sterile technique, etc. in the ORs. We provide, as I mentioned, pharmacy staff with education through a variety of different formats. And then system-wide with policy and procedure updates, we've worked closely with the our safety colleagues to help update policies and procedures associated with sterile compounding and hazardous medication handling, and then also compliance initiatives. We work pretty closely with our supply colleagues for sourcing, communication with vendors, and managing any back orders we might have. We're always coming up with new great ideas about how we can improve processes, but as we all know, sometimes those cost money. We need new supplies or different supplies, and so it's important to manage our budget with that. And then we're also trying to track our usage and our cost trending to make sure that we're not spending too much money in one area. You know, we have found in a couple of instances, you know, supplies that we didn't know were hidden in a closet somewhere, and so sometimes spikes in our usage and our cost can highlight those things, and we can find, you know, ways to decrease costs and decrease our budget use. And then we also provide reporting about supply management to our subcommittee and oversight committees and administration. We help monitor environments with space and facilities. We've been coordinating renovations for the USP 800 compliance, and we also help manage downtime. You know, we've worked closely with our plant operations teams to help troubleshoot downtimes that we've experienced. You know, we're a big hospital, and sometimes an HVAC issue can cause downstream effects in our clean rooms, and so we've worked closely with our plant operations team to try to minimize that as much as possible. We're also intimately involved in the temperature, humidity, and pressure monitoring of our clean rooms, and as I mentioned, our viable and non-viable testing. We've helped with other environmental initiatives, our cleaning documentation, and the effects of our cleaning supplies. You know, as you know, some of the cleaning supplies that we use in our clean rooms can actually break down certain surfaces, so we have to make sure that we are monitoring the use of our cleaning supplies and making sure that we're using them properly and removing them properly, etc., after we use them to disinfect surfaces. And then also engineering controls. So our secondary engineering controls are our rooms, our primary engineering controls are our hoods, and then our CSTDs were involved in helping to manage and maintain all of those. We work with our service partners in vendor management for clean room certification. Our 797 compliance documentation, we use a software system for that, and work with our software vendors to help constantly improve those processes and improve our usage of those systems to make sure that we're getting the most out of those systems. We also have an electronic temperature and humidity monitoring system with an RFID tags that we help to make process improvements and design our reports so that we can present that information in the clearest way possible to our surveyors. And then we also work with our outsourcing service partners and any consultants. And then, you know, we're constantly evaluating potential services as well. We all know there is a huge focus in the market right now on items and services to support sterile products. And so we evaluate those to see if they would be useful for our system. We have a couple of committees that really focus mainly on sterile products. The Sterile Products Subcommittee provides compliance and operational support for sterile products compounding at the Vanderbilt Adult and Children's Hospitals. As a group, we review the national medication safety alerts from various best practice organizations and also regulatory bodies. We help coordinate development, review and revision of policies, SOPs, and reference documents. And then we also identify and develop staff education and operational plans to establish and maintain compliance. This is the group that really does the nuts and bolts of the work. We also make sure that we consistently apply the pharmacy sterile compounding policies and SOPs in all areas. And so the co-chairs of this committee are myself, the Program Director for Sterile Products Compliance, the VUH Sterile Products Manager, and the Children's Hospital Sterile Products Manager. We also coordinate review, the three of us coordinate review of all of the documents that are due for review and due for updates. We coordinate distribution of documents, and then we also coordinate meeting management activities such as agendas, minute distribution, etc., and then follow-up after meetings. We have representatives from all areas, compounding areas, including the off-site allergy clinics on our sterile products subcommittee. They gather input from their colleagues, their peers. Most of the individuals on this committee are area supervisors or managers, and so they gather information from their staff. They communicate discussions and issues to the subcommittee and then back again to their staff. They help us to distribute education and distribute new information about process improvements. They help us understand and utilize benchmarking representatives of best practice. They help respond to document approval requests within designated time frames. So the three co-chairs may develop the changes for SOPs with input from content experts, and then we send it out to the committee electronically for approval. And then they actively participate in the meetings and any related activities. The Sterile Products Oversight Committee is a committee that actually serves to provide oversight and support for maintaining compliance with regulatory standards and safe practice guidelines. They set the general direction and policy for sterile products compounding. They help us establish a quality assurance and control plan. They review high-level reports and trends and audit results, as well as our room certification and viable sampling results. They help us determine any modifications we may need or expansion, including provision of resources for those expansions or modifications. They help us correct or report any deficiencies within timeframes, and then they also review guidance from regulatory organizations, just as the subcommittee does, and help us come up with necessary improvements and develop implementation plans if necessary. The co-chairs of this committee are the Chief Pharmacy Officer and Director of Pharmacy for the Vanderbilt Adult and Children's Hospitals. The membership has committee representatives from accreditations and standards, risk and insurance management, safety, compliance and process improvement, epidemiology, and then several adult and pediatric pharmacy leaders. So while the subcommittee is mainly comprised of representatives from those 11 pharmacy areas and 2 clinic areas that have sterile compounding clean rooms, this committee is really representative of the entire hospital, and our colleagues on this team really help provide leadership for our sterile compounding activities. So our current initiatives that we're working on in our sterile products compliance program include, as I mentioned, insourcing our viable sampling processes. We're looking to do internal monthly viable sampling. We're really trying to be proactive about what we anticipate with proposed revisions to USP 797 and do as much as we can now. We're suspicious that USP 797 updates and USP 800 may coincide as far as timelines. So we're trying to do as much as we can now and be proactive about it. So we're actually in the process of doing some discovery for doing a monthly internal viable sampling process. We've got a couple of air samplers, and we're looking at evaluating cost of that program and utilizing an outsourcing lab to do some of our testing. We have centralized temperature and humidity monitoring. We're doing that through our RFID process, and we are constantly trying to improve our reports and also update our tags based on NIST certification, etc. We've centralized our media fill coordination, so all of the areas, and we have over 200 staff members that have to do media fills every year, or in the case of high-risk compounding, every 6 months. So we're trying to centralize the incubation of those activity of the media fill components. And so we've actually developed a process for areas to send us their media challenges where we document them in a spreadsheet and then put them in the incubator, and then we check them after the designated amount of time, either for the fingertips or the media bags. And we help to develop the media challenge processes and continually update those as necessary. We're also working on updating our training program, providing a centralized didactic portion of training that would kind of explain some of the things we've run into in our surveys that we think are knowledge deficits, which are, room design, allowing staff to really practice aseptic technique and hand hygiene in a safe environment where it's okay to mess up, when we're not actually in a clean room environment or we're not actually making a patient preparation, and really take that training program into a classroom setting for the first couple of weeks so that once trainees get to sterile products areas, they have the basics down, they have the knowledge down, and they can really focus on learning how to make preparations in the area to which they're assigned. We're also, as I mentioned several times, because I've mentioned it several times, you may know that we are working pretty diligently on this, USP 800 planning. We continue to work on tracking of our procurement costs and supplies. We're actually developing a database that we can use to track media challenges. Currently we're using a spreadsheet, so we're working with our pharmacy informatics team to develop a database where we can track our media challenge and sterility testing activities in a database that's easily reportable so that we can keep as much of our documentation electronic as possible. And then we're also getting the EPIC system in November of 2017. So coming up pretty soon, we'll be going live with EPIC. And so we're helping to evaluate and plan and build for EPIC for anything related to sterile products. So our future goals, things we'd really like to work on as soon as we free up some time by completing some of our current projects, is garbing updates. We'd like to make some changes to how, our sterile gowns and how we utilize those, how often we change those gowns. We would also like to make some cleaning system updates. We know there are some the programs out there that have a very scientific way of providing cleaning systems, cleaning processes and supplies, etc. So we would like to look into that. We are gearing up for USP 797, looking forward to that, the proposed 797 being actually published and getting an implementation date so that we can really start hitting the ground running with anything we haven't already addressed. We're, as I said, waiting with bated breath for the FDA guidance for hospitals and health systems so we can make sure that we're compliant with that. We're considering building a 503B outsourcing facility for Vanderbilt. Not sure if this will happen or not, but it would seem to solve a lot of issues that may come up with the hospital and health system FDA guidance. And then we're also looking at considering certification, some kind of sterile compounding certification for our institution, whether that be PCAB, Joint Commission certification that recently was has been offered, and how we're going to handle that in the future. So those are some of the things that we would like to work on, among other things. We're constantly identifying things we would like to work on, process improvements we would like to focus on. So don't anticipate being bored anytime in the next few years. And with that, I'll wrap up and see if anybody has any questions.
Thank you so much, Lindsay. If anyone has any questions, you can either electronically raise your hand and I will unmute your line, or feel free to type it in the question box that's in the panel on the right side of your screen. As we're waiting for any questions to come in, if you found this webinar helpful, please let us know. We will have it recorded for others to listen to it in the future. But if you also have any other ideas about future webinars, specifically about health system topics, please let us know, and we can try to help fill that gap. All right, I see one. I don't have any questions popping up yet. So feel free. My name is Lucy Adkins again at the association. Just drop me an email. It's just Lucy, Lucy, at tnfarm.org. And I'll be happy to put you in touch with Dr. Ford as well. We did get one question pop up. And the question is, Lindsay, what do you think about the change in scope and intensity of recent regulatory visits?
So I think that in the last couple of years, we've seen a huge change in the scope and intensity of regulatory visits. There seems to be a greater focus on a broad range of sterile compounding requirements, from documentation to how we garb. Lots of focus on education from our regulatory visits and our surveyors. They have come and gone into the clean rooms, observed our aseptic technique, observed how clean our rooms are, given us feedback on changes that they would suggest that we consider making. Have given us quite a bit of great feedback on things that we may not have even thought about. But the scope has really broadened to include just about everything you can think of as far as sterile compounding. The intensity is also, especially with our board visits, has I think increased. We've definitely seen a greater need for time to address the questions and the documentation requests from regulatory visits. It takes more time to conduct these surveys and to respond to the surveys, so there's definitely been a dedication of time, especially in our survey window. But all in all, I think that even with the increased scope and intensity and all the effort that we have had to put into preparing for and conducting these regulatory visits, we've actually learned quite a bit from the process, and it has allowed us to make some process improvements that we may not have identified on our own. So it does seem more intense, but I think all in all it's been an improvement.
Great, thank you. All right, I do not see any other questions popping up, so we will go ahead and end the webinar for today. But again, feel free to reach out to me and I will be happy to put you in touch with Lindsay, as well as welcome any ideas that you might have for future webinars. So I hope everyone enjoys the rest of your day. Thank you so much.
Thank you.